On the vaccine rollout, joining us live now is New South Wales Royal Australian College of General Practitioners Chair, Dr. Charlotte Hespe. Appreciate your time, Dr. Hespe. It's pretty concerning, is it, to hear of another blood clotting case today. Can you give us a sense of how GPs are managing the risks involved with those blood clots?
Can I say that GPs manage risk with all investigations and management every day? That's part of our job. So GPs are basically doing what they're good at and having those conversations with you. So to help you understand what that risk is, as we're being told, it's a 1 in 350,000 at this point in time in the Australian context. We're told that at most it should be 1 in 200,000, which is still an extraordinarily small risk. But it's about understanding the context, what it means to you and what you're wanting, what are the benefits of having the vaccine. And I would still strongly suggest that the benefits of us all being vaccinated strongly outweigh that risk.
Are you disappointed that the government has abandoned setting a timeline now for the vaccine rollout?
From my perspective as a GP, I don't really mind what their goal is. I just want to get the job done. So I'd like to be able to have the vaccines there so that we can actually roll it out to all of the population who is actually really keen still to be vaccinated and move out, a bit like the business community. So the trouble with targets is that we have conversations about not meeting them. I just want to get it done. Let's just do it. We're ready and waiting in general practice.
Has the rollout been bungled, do you think, or is the argument that we're not on a burning bridge here in Australia, is that an argument that does justify the slower pace?
Yeah, I think that we are extraordinarily fortunate. We aren't, as you say, on a burning bridge. We have no community transmission of COVID at this point in time, which then, of course, makes it difficult sometimes to have that conversation about why I would be getting vaccinated. But we just have to look at our neighbours. Let's look at Papua New Guinea, for instance, and understand that this is a dreadful infection. It is causing terrible chaos in the rest of the world, and we're just in this very isolated bubble of not having any cases. And so we do have that luxury of being able to look and see what's happening with the vaccines and do it in the safest, most risk-averse way that we possibly can.
You mentioned that GPs really just want to get those deliveries, get their hands on the vaccine so they can start administering it. How is that going in terms of communication between the authorities and individual GP clinics? Are GPs in a better position now in terms of knowing where they stand about the supply of the vaccines that they'll be receiving?
Can I say probably no? But we are getting the sort of the small dribble of supply coming in. So everything that comes in is going out, and we've already seen, if you look at the data that shows the significant increase in vaccination rates that happened as soon as it hit general practice land. We're doing a great job. But, you know, we could appreciate having more and better communications and, you know, I mean, but I think it's hard. Every day things change, just like today, another case coming out, so that we do understand this is a real entity. And more to the point, though, we understand exactly that it is related to the vaccine. It's not related to anything else. There is no other risk if you've had a clotting disorder before that's linked with this particular disorder. And if we can recognise it early enough, it does certainly look as if it is treatable, which means we can decrease the mortality or the death rate from that disorder, which is great.
Are we seeing people in that first rollout phase, the 70-plus age group? Anecdotally, we've been seeing stories of people in that age group cancelling their appointments after we had the developments on the AstraZeneca vaccine last week. Is that something that you're hearing is happening across the board?
No, I don't think so. I think people were quite wisely standing back and just, you know, saying, OK, what's happening? What is the risk? And how do we go forward? And I think we've sort of taken stock, looked at, we've got far more information around what the disorder is, how to detect it and the risk. And certainly for those over 70, I would be strongly encouraging you to go and get vaccinated, because the risk for COVID for you still far outweighs the risk of a vaccination.
Dr. Charlotte Hespe, appreciate you joining us. Thanks for your time.
Thanks a lot.